Okay, so this is allergic response. Do not worry too much about the specifics right here. But what do we see in general when someone has an allergic response? Well, you see increased blood flow. So if someone has allergy, this is why it gets red. You also get fluid release into tissues, and this is what causes swelling. So if you've ever had hives, like one time I think I ate, I don't think I'm allergic to shrimp. It only had happened once. Maybe it was a bad batch, but I started getting all these bumps and my skin got super raised. I just took a antihistamine and it was fine. But this is why if you've ever had hives or allergic response, this is why you typically get the swelling. You have this increase, your blood vessels in essence become a little leakier, thereby releasing more fluid into the surrounding tissues. You also get all these immune cells that help to, they think there's some sort of immune threat. This is why the blood vessels become more leaky because again, it makes it easier for these immune cells to go through. But don't worry too much. Again, immunology is in PHYL 142. Okay, so what I'm getting at is this thing called anaphylaxis. So this is a very severe allergic reaction. So what happens is that all that thing talked about, so things like the redness, the swelling, the leaking of fluids, this is now like a severe version of this that can be life-threatening. So again, if you have and it also causes bronchoconstriction as well. And the systemic blood vessels dilate. So things that, what if you have your blood vessels all around your body dilating? Well, thing is that if they become leaky, they're going to leak the fluid from your blood vessels to the rest of your body. But if all the fluid from your blood vessels and in your circulatory system are starting to leak out of your circulatory system, what does that mean for the volume of blood inside your circulatory system? If it's starting to lose it to its environment, that means your circulatory system experiences a loss of blood volume and pressure. So this is why you see this, like, oh, she has a severe allergic reaction. This is why she looks super puffy and red. You have all those blood vessels opening up because of a severe allergic reaction, and now it's swelling all these surrounding tissues. And this is why it's very life-threatening if you have an anaphylactic reaction, because again, if you have this fluid leaking from your blood vessels, what happens to the blood inside your vessels? Well, it's going to lose pressure. It's like if you had like a hose and you start poking all these holes in the hose, it's going to lower the pressure inside the hose. And it can lead to cardiac arrest because again, if you lose pressure in your blood, well, that's going to affect your heart and how you can act, the rate at which it can circulate blood. If it doesn't have enough pressure, it's going to have difficulty circulating the blood to where it can supply oxygen to all your tissues, your brain, and also collect the waste as well. And this is why typically in anaphylaxis and severe allergic reaction, like if someone has a really severe peanut allergy or shellfish allergy, they might carry one of these EpiPens. So what does EpiPen stand for? Well, you can see that the epi stands for epinephrine. So if you go straight from the horse's mouth, what is epinephrine? It's chemically the same as the epinephrine you're producing in your body right now. So how does it work? Well, it constricts blood vessels, relaxes smooth muscles in the lungs, stimulates the heart, and works to reduce hives and swelling. Hey, alpha 1, where is that located? On blood vessels, right? So if you have epinephrine stimulating alpha 1 receptors, that's going to constrict those blood vessels. So again, constricting those blood vessels makes them less leaky. So now you can also increase the pressure and prevent the loss of volume from your circulatory system. Beta 1 agonists. Where do you find beta 1 receptors? In your heart, right? And what does beta 1 and alpha and epinephrine do to beta 1 receptors? It causes your heart to beat stronger and faster. Hey, stimulates the heart, right? And then beta 2 agonists. Where do you find those? Among many places, your lungs, right? And lungs and airways. And what is that going to do? It's going to open up the airways. Hey, what does EpiPen say it does? It relaxes smooth muscles to reduce wheezing and improve breathing. How does it do that? It opens up your airways. But what are the side effects of EpiPen? Again, this is on their own website. So things include fast, irregular pounding heartbeat, sweating, nausea or vomiting, breathing problems, paleness, dizziness, weakness, shakiness, headache, anxiety. Now let's ask the chat. Does this sound like sympathetic or parasympathetic? Yeah, so yes, everyone's getting it right. It's sympathetic. So again, this is not a side effect that's unintended because this is the same as the epinephrine that's in your sympathetic nervous system. Is it a surprise? It's going to cause all these other things that are associated with your sympathetic nervous system. So again, these side effects are not just something, there's effects that are, it's not like, oh, oopsie doopsie, this happens at random. We know this is going to happen because we know the effects of the sympathetic nervous system.